Hello, welcome to this med short. In this short, we are talking about aspirin. What is aspirin? Well, aspirin is going to be classified as a few different things. Technically, it is a salicylate, which just means that it originates from salicylic acid. It is also an NSAID, meaning it is a non-steroid anti-inflammatory drug. So it's going to cause a reduction in inflammation without the use of steroids. It's also referred to as an antiplatelet, which, spoilers, that is what it is going to do or why we are using it. When are we using this? We are going to use this with acute coronary syndrome / MI suspicion. Why are we going to be using it during that time? Well, when we are giving aspirin, what's going to happen is it is going to have an antiplatelet effect. So it's going to directly impact the coagulation of platelets, the combining of platelets, the aggregation of platelets, so that they are less likely to meet one another. So we got ourselves platelet here. They kind of have these gnarly little tufts on them to help them attach to things. And it's reaching out. Or the other platelet, but that is not allowed. So these platelets, we're zooming in here to our blood vessel here. We have plaque or some sort of calcium buildup that is reducing the real estate inside our blood vessels so that there's less space to move through. And so things are more likely to get gummed up and stuck around this area. It's kind of like a bottleneck area, if you will. And so when we give aspirin, these platelets are going to be able to slip on through past each other. They're going to be slippery. They're less likely to hold on to one another and hold on to surfaces. And so that's why it is very useful when we have a suspicion of acute coronary syndrome or MI. And so I want you to think too, that's not just chest pain. You know, let's think more broadly. Let's cast a wider net here. That's, you know, potentially abdominal pain, weakness, shortness of breath, syncope. You know, let's expand our horizon here and think, you know, could this really be something else, you know? And how is it going to be given? It is going to be chewed, and that is 324 milligrams, and that is either one large adult dose or 4 baby aspirin at 81 milligrams. If you guys have any comments, questions, concerns about aspirin or anything, don't hesitate to reach out.